Thanks everyone for joining us today. Welcome to today's webinar entitled Creating a Child-Safe Culture, Culture Change in Response to the Royal Commission into Institutional Child Sex Abuse. Before introducing our speaker, I just wish to acknowledge the traditional owners of the land upon which all participants of this webinar stand and pay my respects to elders past, present and emerging. Today we will hear from Marie Slattery, Child Safe Coordinator for Parkerville Children and Youth Care, on taking the recommendations from the Royal Commission and making them a functional reality. Marie has qualifications in many fields, including psychology, and has a career that spans almost 2 decades and 3 countries, their cultures and systems. In all of that time, she has been providing services to children and families with complex needs. Marie is a passionate advocate for children's rights, child safety, quality, and cultural change. We're really fortunate to be able to learn from her experience today, and with that, I'd like to hand over to you, Marie. Thank you.
Thanks, Paul. Thanks for that. Hello, everybody, and thank you for joining me today. As Paul said, my name is Marie Slattery, and I'm just going to speak to you today about my organisation and our journey from looking at the Royal Commission and the impact that that has on us as an organisation and how we implemented those standards and what that looks like. So it's really our story, and I hope from me explaining our organisation and who we are and how we did this, that you can take something back to your organisation, because every culture is slightly different in organisations. I would also like to follow on from Paul and just to acknowledge the traditional owners of the land. Here in Perth, it's the Noongar people, and also acknowledge the elders and Aboriginal communities in all of the across Australia where we meet and speak today. So just to give you a bit of background around Parkerville Children and Youth Care and who we are. So Parkerville has been around since 1903, and it was set up as an orphanage by Sister Kate, who was an Anglican nun who came over from England with a group of children. We still have our head office up in the hills in this beautiful kind of rural part of Perth, just outside the city. And that was our origins, really. So, you know, now in 2019, we span across 12 locations, some of them up as far as the Murchison in the remote parts of Western Australia. And we have offices from the Metro South down to Bunbury, and then here in Midland. And we also have 165 staff, and we've provided services to over 13,000 children and families. So just to give you a bit of an idea of how big we are and what that looks like in regards to implementing change like we have done. So I suppose I've seen where some of you are from. So I know there's a lot of research institutions and people that have been in this line of work for a fair bit of time, and I'm sure that you're all absolutely familiar with the statistics around what we know about child abuse and how the children in Australia are impacted by that. And again, this all, I suppose, leads into the Royal Commission into institutional child sexual abuse, and that really was the foundation for why we decided to go down this route. Plus Parkerville's, you know, main business or our core objectives are to support children to recover from the trauma of abuse, and also about prevention. So it's about that community engagement and raising awareness around child abuse and child sexual abuse in particular. So these are all the stats, which again, as I said, I'm sure you're very familiar with. So let me go straight into the why. So why did Parkerville Children and Youth Care decide to go down the route of child safe accreditation? Now, I suppose to point out, we actually decided to do this in 2016. So this was prior to the final report being handed down by the Royal Commission in December 2018. We had already looked at what was coming from the Royal Commission, and we had decided that due to uncertainty around what that might look like, that we would begin to start reviewing how we did things from a child safe culture perspective. The other thing in Western Australia, which I know it's not the same in other states, is there's no oversight of an independent body in regards to children's service providers. So we have one of our core business is out-of-home care. You know, stems from our origins of Sister Kate, but we still provide a large out-of-home care service, both in foster care and in residential care group homes. And there is no independent oversight body for this type of service. And as we all know, this is one of the main areas where children are extremely vulnerable and would have led to a lot of the information to the Royal Commission. So the next one is around the importance that culture plays. And again, this is a real passion of mine around the impact of culture and what that looks like. And from working across 3 different countries, you can really see and hear the nuances in how we work with children and what that means for us as an organization. So it's about us as an organization in 2016 saying, you know what, we provide services to children. We've read what the Royal Commission has released so far. We believe that we need some type of oversight or external body to look at what we're doing, because we believe that we're doing things well. But again, that's an internal system that we were looking at ourselves. And we prioritize child safety. So we had that ongoing commitment to always improve and review what we were doing. We have a very, very established quality management system here at Parkerville, and this has really aided us in all types of implementation of organization-wide change. And I know some of you out there are part of quality teams, and I think that the quality team here at Parkerville played a key role in process creation and also supporting the rollout of an organization-wide culture change. So really important to have the quality team very much aligned with this process. And as I mentioned, there was a lot of uncertainty around what would this mean, the Royal Commission's recommendations, how would this impact us as an organization? And we felt that we wanted to do something in advance, that we wanted to prepare ourselves for the day when we would all have to implement standards. So the decisions. So at this time, as I said, it was 2016, we didn't have the resources that are available online now. We as an organization just had what it said in the Royal Commission's reports to date. And then we had to look around and go, well, how are we going to do this? How are we going to achieve this? So we decided the best option for us was to engage an external organisation through the Australian Childhood Foundation called the Safeguarding Programme, Safeguarding Children Programme. And this programme is about reviewing us as a child safe organisation and then giving us the stamp of approval or giving us recommendations on how we need to brush up and become more child safe. So this is the decision that we decided to go down. But I suppose now today in 2019, there's lots of resources available online for organizations in regards to reflecting on, self-assessment tools and different things like that. And I have to say the Commissioner for Children and Young People here in WA has done a tremendous amount of work. And all of that work is available on their website around assessing your organisation and tools to support people to start thinking about child safe standards and also about how to implement them. I'll give you a list of websites that I found really useful at the end, and it's near the end of the slides. And the slides will be available to people after today, so you'll have those links available to you. I suppose it's just, when we look at the Commissioner for Children and Young People, they've got the 9 standards, the 9 child safe standards, and then after that, then the Australian Human Rights Commission, they came out with their 10 standards, and then we have the Royal Commission into Institutional Responses, and they had 10 key elements of child safe institutions. From my perspective, they all mean the same thing. They're just a different way of identifying different areas that you need to consider while implementing things in your organization and what it means to be child safe. So, for example, the one has 9 and one has 10, and the ones that we chose to go down the road with, the safeguarding standards, there's actually 7. But I suppose just to note that that was in 2016. There was 7 standards, and all of these standards cover the exact same information as is covered in these ones. So just to be mindful that they all are saying the same thing. It's just different ways of doing it. And, the Australian Human Rights Commission, the national principles are the ones that have been endorsed. And again, you can go to their website and they've got some great resources to support people to look at their organization. Again, I'll provide a link to that at the end. So again, all the same, but this was before these were all released, I suppose, in 2016. So these were the 7 standards that we decided we would go down the route of. And I just wanted to talk to you a little bit about how that was, what we needed to do in order to become accredited. So that was ACF, the Australian Childhood Foundation, and they said, we've got a safeguarding program. These are the standards that you have to meet, and we will, this is our program. So we engaged the Safeguarding Children Initiative program. And what we needed, and this is really important, what we needed in order to get underway to becoming a child safe organization, we needed the key cornerstone of culture change is that it's a top-down approach. So the chief executive, Basil Hanna here at Parkerville, was very much the forerunner and very much leading the charge towards becoming child safe. And I think that's really important because there's a lot to do and there's a lot to reflect on, and there might be new processes or new culture, but it really was a top-down approach and everybody was on board. But again, it's not there was some parts that were very challenging, and it definitely needed the assistance of the top of the organization to really push that. So that was one of the key things that we needed. We needed to review our current processes. We needed to look at the gaps. We thought that we did lots of things really well. We were interested to see what we hadn't thought of. You don't know what you don't know. So it was very interesting to look at the 7 standards and then figure out what can we do more of. So we might have tailored some of our processes a little bit, or we might have said, yep, that's a good process, and feel that covers it. But then there would have been gaps. So we would have had to look at what the gaps were. We also had the board involved in this. So this was an whole organization approach. The board, the staff, the senior management group, and volunteers as well. Everybody did an induction into child safe, and everybody did training on becoming a child safe organization, or what that meant. So similar enough to what we'll talk about today, I give staff that understanding in induction around what does it mean, how do these standards actually work in our day-to-day business. So then we had to participate with the ACF's external audit. So that meant that their auditors flew over from Melbourne, and they came and they met with staff and they interviewed them, and they looked at our HR files, and they did a bit of a review of the HR files, and they also did a desktop review. So they reviewed all of our policies and processes to see if we had covered what was required from the standards. And then they spoke to the staff, and that's a big one because they want to know that the practice is happening. It's not just enough to have lots and lots of processes, which we absolutely do, but it was really important to know about the staff's awareness and knowledge of those processes, and were they actually happening on a day-to-day basis. And again, that would give weight to the culture, or what staff's thoughts on certain processes were, which I'll talk about with you in a few minutes. So then we looked at culture. So we were assessed then by ACF from the Safeguarding Children program on whether they decided that we had a child safe culture or not. So how do we go about this? So what we did as an organization is we sat down and we thought, okay, how are we going to get this across the line? We started out at the beginning of 2016, and we aimed to go for accreditation have the audit done in August 2016, and then go through it within 1 year. So this was a massive push for us as an organization. It was all hands on deck, and we achieved it in a very short time frame, really. So we identified a child safe leader, which was me, and it's always good to have one person try and lead this project that's passionate about it. We have a child safe reference group, and this group consisted of people from across the organization, but really the decision makers and the chief executives and the chief executive and various managers. Because again, you're using this forum to make decisions around how we're going to do things. So people who have the authority to make those decisions, and also to communicate to the wider organization. So it was helpful to have a manager who might have 25 staff in their team, and they would then communicate that. This group is still running today. So this is years and years later. This group still consistently communicates all areas to do with child safe organization. Every year we do a survey on the staff around the baseline knowledge of their attitudes. We actually use the national principles to base our survey on, just to give the staff a different perspective. As I said, they all say the same thing about keeping children safe. So we do an attitude survey once a year to try and tune in to what's going on around the organization and then respond to that. We had a communication plan, which was really, this was the big one, because again, it was all well and good the senior management group having the knowledge on the new processes and what we needed to do, but it was really important that everyone in the whole organization was aware of what we were doing, why we were doing it, and what their role was. And when we released new pieces of information or new processes, this is how we communicated with them. The mapping of all of the standards. Well, I wish that one of the self-assessment tools were around back in the day, because this is obviously very tricky. But ACF were great, as in, they had a tool to help us map our organization against the standards. And that's where we looked at all of the standards and the sub-standards, and what processes, as I said, we currently have in place and what practice, and then develop an action plan around any gaps or any alterations that we needed in order to make that. And then it had to be endorsed. And this is the thing, it has to be endorsed at the senior level to have that actioned. Then we wrote lots of new policies, and then we had the implementation plan. So again, all well and good to have loads and loads of policies, but actually, how does that translate into the day-to-day working of every staff member? And how does that translate, again, in time into the culture of the organization? And then we rolled all of this out. So I suppose just to let you know that we did start the process in early 2016, and we did actually get accredited in November 2016. So as an organization, we've actually been accredited for almost 3 years now, and we've just headed into the end of our 3rd year of accreditation, which meant that we actually had to be re-accredited in the coming months, and we've just participated in an audit. So it's our 2nd audit, having people from Melbourne, from ACF, come over and meet with the staff, review our processes, look at our compliance, and then write a report to make a recommendation. And again, there's preparation that goes into that. And all of the standards that I'm going to talk about with you today, it's about us checking in with the staff and the teams to understand, do they know what this means and how does this work for them in the day-to-day? As I said, we have a fabulous quality management system. And one of the things that we were surprised, because we had loads of processes, was when ACF said to us, what about the standard 1, the commitment to safeguarding children? I thought, well, of course we're committed to safeguarding children. We work with children. That's our core business. That's our mission. Of course we are. But we actually never wrote it down explicitly in one location around what our commitment was to children. So this is one of those real, obvious ones that I suppose wasn't obvious to us. And in doing so, we wrote a commitment statement, and we placed it on the front of one of our process manuals. And again, I was quite surprised really that we hadn't got one of these, that we didn't have a commitment statement. There is examples of commitment statements available on some of the websites that I mentioned, and I'll give you the links later on. If it's basically every person's role is broken down in the organization. So as a staff member, your commitment is to keep children safe, to provide them with a therapeutic, nurturing environment, to report if a child has been harmed or they're at risk, and then to conduct yourself in a professional, safe way with children. So it's just around keeping ourselves accountable and being clear. So that's the role of the staff. Then there would be a different role for the senior management group, who would be a different role for me as the child safe coordinator, and then the board members and the chief executive. So it's just about being really clear on what all of our roles are and what our commitments are to children. So that was one of those ones that we created brand new in order to meet one of the standards and be clear. So standard 2, so you'll see this in the other standards to do with the national principles and the commissioner in WA. Standard 2 around personnel roles and conduct is a big one. And it's interesting, this one, because we have lots of HR processes, as I'm sure most of you do in your organizations. But this really was moving more towards a child-focused HR process, which we wouldn't have been familiar with before that. So we would have the standard, I will conduct myself in a professional way and I will act in a professional way. But really what this did was it broke that down. It said, actually, that's not good enough. You need to be clear on how you want people to act around children. And we thought, oh, okay. So, it's those things around explaining to staff around physically, you're not to, again, depending on your role in the organization. So for me, as the child safe coordinator and the manager of learning and development, I don't provide direct services to children. So, it'd be very clear for me that I'm not to transport children in my car. I'm not to, handle children or, and in regards to supervision of children, that wouldn't be my role. So it's just about being really clear with everyone across the whole organization about what we want you to do in order to keep children safe. And we all sign it. So the CE signs it, the board members sign it, all the staff sign it. So we all actually are able to hold each other to account. And I always say this to the staff, if you see me buying gifts for children in the shop and you know that they're Parkerville children, then this is an example of the code of conduct has been breached, because part of it is actually about gift giving. So it's built around those kind of type of grooming behaviors, and it really is very clear on what you can and can't do. Again, depending on your role, if you were a primary care or a foster care, it's very different to, someone like myself. But again, it's clear, what you can and can't do from this document. Very child focused, very clear. And I think it's really helped us to hold each other to account, and we've used it a lot around supporting us to know what we're supposed to do. Again, common sense is not that common, and it really helps to have those conversations with staff around gift giving, as I said, or transporting children, or use of technology, all of these things that we assume people know what professional conduct means, as in don't give the children your mobile phone, or don't take pictures of the children using your mobile phone, or don't take the children to your house, or all of these things are written down and they're really, really clear, which adds that standard of accountability and clarity for all of the staff and the board and the CE. We use it also as an opportunity to keep those conversations going. So it's not just a document that you sign when you come in the door at Parkerville. It's actually used as an opportunity to discuss it at your team meeting. So they might say, okay, let's discuss today about overnight stays. Is everybody clear on what it means for you around overnight stays and what you need to do if the children wanted to do that? So it's just about keeping ourselves informed and using it as an active tool to raise awareness all the time and make sure everybody's doing the right thing. And we obviously monitor this around staff awareness and behaviours. Okay, recruitment and screening. Again, HR plays such a massive role in this. They really, really do. And I suppose that was the thing I don't think I realised, because I don't work in HR. They really play a massive part, and they cannot be underestimated how important they are. They are the first line of defence when it comes to somebody trying to gain access to your organisation or club or institution and seek to gain access to harm children. So really it's about talking to HR and looking at what they already do, which I'm sure they do lots of things, because we all go through some type of process to be recruited, but it's also looking at what can we add to bolster that. So, something like, for example, the standardized questions in the interviews. I mean, I think we did do a standardized question, but now we do 2 standardized questions, and we're very intentional about why we ask them. 2 referee checks. I mean, people probably do that anyway, but we actually ask standardized questions about the person's suitability to work with children in the interview. We insist that the person comes with them with the Working with Children's check card. It's no longer good enough to have a receipt, and also with police clearances. So these things all need to be cited before the person actually walks in the door. The other thing is that we actually put it on our website. So when we advertise a job, from that first point of contact to the public, we explain to them that we are a child safe organisation and that we do check, we do expect this type of compliance, and we do actually check. So this was a big, this was a big job in regards to HR working really closely with myself and working really closely with the reference group. So we have the manager of HR sit as part of the child safe reference group, because they're actually really impacted by this. And a lot of the compliance is actually by checking the HR files to see if we've done what we said we were going to do. So did the person get an interview? Were they asked standardized questions? Did you check the 2 references? And do they have all their documentation and compliance? HR plays a massive role in keeping us all on the straight and narrow when it comes to this. The other thing we did, and again, maybe this was us, we did local inductions with our staff, but we didn't do a big generic induction checklist. We did inductions, but they varied between teams and departments and office sites. So we actually created an induction checklist. And I mean, it's 8 pages long, so it's a big, big document. And at the time, it felt like a big, big deal. But really 3 years later now, and we can see how helpful that document is to make sure that everybody is inducted into the organization and has a basic level of understanding around our policies, our process, our occupational health and safety, and knowing what training they have to do and what they need to know in order to be appropriate in their job and how to respond to children. So that was really helpful, really, really helpful. And we get everyone to do that now because we make sure that everyone is fully informed when they come in the door. And this document can take up to 3 months to complete, and then it's returned to the HR department and it's saved on everybody's file. So we can demonstrate as an organization that if you come in the door to us, we will make sure that we will give you all of the information that you need to do in order to make you the best at your job and the safest at your job when it comes to working with children. So this was a really good one, I think, to go through. Okay, standard 4. Again, standard 4 is just the ACF standard, but there's lots on induction and training. And when you look at the Royal Commission and the findings from the Royal Commission and the factors that they looked at, or the trends around what put children at risk, really lots of two of the trends were the lack of knowledge and awareness of the staff around factors that were risky for children. So, staff weren't getting a full induction into the processes, into the how we do things, into the expectations, things like that. So really it's important that every staff member gets an induction, and here at Parkerville they get a local induction and a generic organization-wide induction. So the local induction is that checklist that I talked about, where you make sure that you know everything that's expected of you in your role, in your team, in your office. And the generic one is about the culture of the organization. So this is where the chief executive stands up and he speaks about the history and who we are and our values. And I stand up and talk about child safe organization and what that means. So we really put forward the culture. We're very front and center about giving people permission to stand up for, children's rights and to always report. So it's about creating that environment from the moment people come into the organization around our expectation of them in regards to child safety and our accountability ourselves. We have lots of mandatory training within Parkerville. We do an internal calendar, and again it has to be mandatory because we have that element of expectation that everyone has a basic level of knowledge around the children that we work with, their needs and how they've been impacted by their histories and their pasts, and how we can work with that in the safest way possible. And again, some children have very challenging behaviors, but we have to train people on how to manage those challenging behaviors in a therapeutic and a safe way for the children and for the staff. We train people about incident reporting. There's a whole standard about incident reporting, which I'll talk about. We also train people about self-care. Cultural awareness and competency is very important. And then that online safeguarding. So because we went down the route of going with ACF, we have this online training package or 3-hour module that all staff have to complete as part of their induction. And again, that just talks about grooming and a lot of that kind of what behaviors to look out for and scenarios around what's safe and what's unsafe. So again, that basic level of understanding. We also do lots of professional development for staff. So again, that's when you come in the door, you do all the mandatory training, you get your induction, but then what about ongoing moving forward? So we do have monthly in-services, which is a professional development or a knowledge raising hour for all staff. We have people from across the community come in, from LGBT+, from people who have stories to tell about their care experience and whether it was good or bad. Someone like Create Foundation, they would come in and speak on behalf of the young people, or sometimes young people would come and speak themselves. We would have people from different cultural groups would come in and give us a discussion on their take on things. And then we would attend conferences and different things and bring that information back to the organization around the impact of trauma on the brain, or something that we would have learned that would be relevant to making us more informed when it comes to working with children. So standard 5 is about involving children and young people. So I suppose this is my question to you. Like, how do you already do this in your organization? And I'm sure that anyone who works with children will do this in some way, but it's about how do we do it? And then what can we do to improve this? So here at Parkerville, we get feedback in lots of different ways. So we have a website that asks for feedback. We have a brochure that we give out to clients at the beginning to say to them, this is how you give us feedback. We have a complaints mechanism that we keep the staff up to date on. We have, this is part of induction around the culture. So we also have surveys that families are contacted once a year over the phone and asked to give their feedback. So we're intentionally going out and asking people to give us feedback. It's not always easy, and sometimes at the heart, like we get lots of positive feedback, but we really want opportunities to improve as well. Tell us something that we can do better. So one of the suggestions around how we can improve it here is, again, it's a bit like the standard number 1, the commitment to safeguarding statement. One of the suggestions is that we actually have an overarching child participation framework where we list all of the ways that we seek feedback from children and young people and families, and actually put it into a process so that it's all in the one spot and that we list all of the ways. So I think that's an opportunity for us to improve. And I'm sure you are thinking about all the ways that you seek feedback and get input from clients. But I suppose it's just looking about what else can you do? Can you tag it all together and have a process so everybody's clear on what we're doing and what the goals are? And do you have a way to review this? Where do you keep all that information and how do you use it as an opportunity to improve what you do as an organization? Ideally, there would be co-design where children and young people would be very much part of developing their own programs. So in our out-of-home care program, we want the children to be part of creating their own care plans about their lives and making decisions that are about them, and then understanding when things aren't the decision they might want, but then that understanding around why it is that way. So it's really that communication and that respect around hearing the voices of children and young people and taking them seriously. Because again, that was one of the big the factors in the Royal Commission. When you look at some of the work that Tim Moore has done, it's about children didn't feel they were taken seriously. So it's about making sure that we have created a space where all children can have an input into their plans. And even if that doesn't happen because of safety reasons, it can't, that they still feel respected enough to put their voices forward and they explain the reasons behind things. So it's really important. This is a really important standard, and I would urge you to think about how to improve what you're currently doing. Standard 6. So when they talk about child abuse reports and allegations, this is the other one, the lack of awareness of staff around what the processes were, and then the lack of knowledge around following the processes, lack of confidence that the processes were too complicated, nobody actually knew what to do. So I suppose this is a big shift, this one for us, because it was so challenging, because we're trying to figure out how do we create an incident reporting process that allows staff to say, actually, I believe that person has breached their code of conduct or their practice and behavior requirements, and ask that question in a safe, respectful way, with the safety of children being at the center of their mind. So we actually had to split our incident reporting process into 2 halves, and one was called Type A and one was called Type B. Type A is about everything to do with children, and Type B is to do with a staff member putting in a report about another staff member. And I suppose the difference is that Type B, it had to be kept separate, because again, it's a staff member about another staff member, so there's the element of confidentiality around that. And this was a tricky process, but again, we wanted to be in line with the Royal Commission, where they said that people were not confident about raising complaints or raising concerns about other staff members, and that was the culture which stopped them from reporting. So we really wanted to focus on creating a culture where people can ask questions about other people, but the focus was always on keeping children safe, and it's about children at the center of all of the decisions and all of the actions that we take. So we did this, and we're still looking at molding this one to fit us, because it affects some groups of people more than others because they have more contact with children. But I suppose this has really helped us as an organization to push past that uncomfortable space of reporting on your colleague or reporting on your a person in your office or a person in your site, because that's the whole point. Like, it's not about our uncomfortable space as adults, it's about focusing on keeping children safe, and we need to push past that. And that's what I say to people in induction, you know, you're here to work with children, and children are our priority, and their safety is paramount. So if it's uncomfortable for you, then you need to push past that, because the expectation is that you report a type B if you have a concern that a staff member has put a child at risk, or there's the potential for that child to be at risk or unsafe. The process around this is linked to the HR process, particularly around staff members, because sometimes it can be a performance development issue or it's a disciplinary issue at times. And we've had challenges around the length of time it takes for the investigation. So, for example, someone puts in a report about me and says that Marie was, I can't think of what something I would be doing, but Marie was doing something that was unsafe with children. A report goes in, and if it gets handed to the department or the police, they have their own processes to follow and their own timeframes, and we have no control over that. As an organisation, we can take action. I can be stood down from my post and suspended, or I can, you know, something will be done in regards internally, but externally we have very little control over the actual process. Where the information is stored and who knows about it. So all these things we had to learn, we muddled our way through around where things are stored and who has access to those. Because remember, some cases are unsubstantiated, you know, and that's the thing we need to be very mindful. And this is why it's important to have HR, because they have all the knowledge and expertise around confidentiality and the rights of employees in regards to their information in their files, and the rights around being treated fairly. So we need to be putting children at the centre and always doing the right thing, but we also need to be respectful of individual staff that are being named and reported about, and making sure that how they're treated is fair and in line with what HR would expect from a compliance legislative perspective. And then when you think about communication, so this is a big one again. Did someone get back to the child after that safety? You know, did we investigate? Did we speak to the child? Did someone get back to the reporter and say, thanks for reporting, you're one of the, we can't tell you anything about the outcome, but we'd like to thank you about participating in making us a child safe organisation. Thanks for doing the right thing, which we do. We send an email to everybody. But again, they don't get any information, because we have to protect the privacy and the rights of the involved personnel, the person who was named on that report. So again, well worth doing, very difficult. And it really is that shift, you know, as in children have to be prioritised over adults and over the organisation, really. So it's about learning what we've learned from the Royal Commission and really implementing that and pushing through that process, no matter how challenging or difficult it is. And I think we've done well, but again, we'll continue to push on this one. So then it comes down to the whole culture. So as you know, culture is something that is not one thing, it's everything really. And we do the survey with staff around their attitudes, and we use the national principles. And we ask them about all the different elements of the national principles in a survey monkey format. We also do internal audits on staff knowledge and process and practice. And this is where the quality team have been really helpful, because they, as part of their normal business, go out and speak to every program and ask them questions, and really helps identify gaps or areas that we need to communicate more. It's not necessarily that staff don't know, it's that maybe we haven't actually told them, or maybe we haven't spent enough time training them, or maybe we haven't had enough discussions for people to fully unpack, because that type B process took a lot of communication for people to understand the process and then the practice, and then understand, and then we needed to listen to the feedback around how we can improve that for staff and, you know, for children as well. We frequently review our incident reports and we look at the databases. So you can imagine if there was lots of type Bs that came in for a particular thing, it could be that the staff actually don't have the training required to be able to do what we want them to do. So when we look at the data, that would inform us to say, actually, we need to put on training in this particular area. We need staff to be more informed, and this will reduce the number of incidents that are being reported, because everybody will be doing what's expected of them in the safest possible way. So again, it's about informing to improve, and helping us have a good look at ourselves around things that are reoccurring. always asking staff about how we can improve things and what can we do. And again, when you have a type B go in against you, that's an uncomfortable feeling that there's been a report. So it's about asking people who've had type Bs, what can we do to improve this process? The process is here for a reason, but always trying to make sure that we're treating everyone with respect, and getting the best outcome really to keep everybody safe in the organization. And again, recognizing champions. This is the big one. We want to praise people and say thank you for putting in that report. Thank you for coming forward and saying that you have a question over that person acting in a safe way. And again, that person is kept confidential, but it's about making sure that we uphold a culture or a space in this organization that we will thank you and praise you for coming forward in good faith about making a report about child safety. And I feel that we do this very strongly, and anytime we do training to do with child safe culture or in induction, I would always say this to people: this is your responsibility and you need to come forward and speak up, and we will support you to do that. So these are the links that I was telling you about that I find really, really useful. Tim Moore's published a paper on children and young people's views on institutional safety. It's not because we're little. It's about that everyday stuff that children are looking at around how do you speak to the people in the organization? Do you speak to each other in a friendly, polite, respectful way? Because, if that's how you speak to your colleagues, then children are more inclined to feel safe around that. And again, it's about taking children safely. They're human beings with rights and needs, and, need to be treated as such. The Safeguarding Children and Young People portal by ACF, again, really helpful, lots of resources. The Commissioner for Children and Young People here in WA, very helpful, lots of self-assessment, lots of thinking about child safety in your organisation. And then the National Child Safe Organisation Standards. Again, they actually have examples of a code of conduct. They have examples of a commitment statement. So really helpful things, you don't have to start from scratch. And then if you decided to go down the route of, which is what we have done, is that we engaged the Australian Childhood Foundation, and we paid them to come to help us go through the Safeguarding Children services process. And then that's a 3-year cycle. And then the costs around that are based on how many people are in your organization and all those kind of things. You kind of need to have an individual package that they will give to you, because they give online training and things. So it's very much the size of your organization and the number of staff and things like that. So all of those, as I said, will be available, but really helpful resources. They've done such good work on informing you around how to get started. So that really brings me to the end of all of my slides. And I suppose just to say that if you had any questions, now might be a good time to ask them. But if you had any questions later on, or you wanted to have a conversation and ask me something a bit more individual about your organization, I suppose, or you had a look on the website and you thought, okay, this looks good, I'd like to start doing that, feel free to give me a call on my numbers there. And the other thing is, if you want to know what we're doing Parkerville wise, you can join our Facebook or our website, and you can subscribe, and we'll give you updates around how we're traveling. So we're just about to go to the final part of our 3rd year of our cycle, reaccreditation, and we'll find out in end of October, November, if we are being accredited. But at this point, it's looking very positive, but we have to meet with the panel and discuss our draft report to see if they will endorse that. Yes, so I think that is all I have to say just now. And feel free to send me an email.
Marie, it's Paul here again. Thank you very much for that very well organised and practical presentation. That's fantastic. We've got a handful of questions. We'll get through as many as we can. The first one comes from Douglas, and he's asking, you've talked about how you involve children and how you, having set yourselves up and having got accredited, how you involve children in their care plans and seeking their feedback. But Douglas is very interested in how you got the voices of children in your ears when you were beginning the accreditation process and during the accreditation process. Now, I noticed you referred to some research by Tim Moore, and also you were in contact with the Commissioner, but was there any other avenues where you could directly hear from children about what they needed for you as you went through the accreditation process?
Mm-hmm. So I suppose what it probably did highlight is that we needed to do more. And we do engage the voices of children, particularly in out-of-home care, because they live with us. And we ask them, their team leaders ask them direct questions around how they're traveling, how their care is going, do they have any concerns, because they're the people with the relationships with them. So rather than creating, child reference groups, which we didn't want to get into doing that, we wanted just to get that staff level of awareness around it first, and then that would trickle down. So 3 years later, we have a new online client management system, and now that has a special section built into it to capture the voice of children. So, and that's filled up by their team leaders, who are the people who oversee their care plan. So not necessarily children as a group implementing into the kind of process accreditation, but more as children on the ground with the staff that they have relationships with, feeding information to their team leaders, which goes into the decisions based on their lives. And then those team leaders feed into the child safe reference group and might say, actually, you need to do more on this, or I don't feel that you're hearing this particular group of young people, it's not applicable. So like an example would be, we had some child safe posters done up, and some of the feedback would be they're not diverse enough. We need to have different faces from different groups and different ages. So it's just about being responsive to children. And we were reluctant to set up a tokenistic child group. We more worked on the relationships that we had with children and asked them to give us their feedback on things like posters and things that we were trying to communicate with them.
Thank you, Marie. We've had another question regarding children with disabilities from Gwyneth, and she's basically asking what sort of accommodations, I think she doesn't mean as in roofing, I think she means, I guess, what changes or what systems have you had to put in place to ensure that children with disabilities are safe, given that they're around 25% of your population?
I suppose just to say that our organisation, we don't specialise in disability services. So we provide services for children in out-of-home care, but we're not actually set up to manage children with disabilities.
Good, thank you for that. Another question here, are you able to talk a bit about the results of your annual staff survey and what it's showing in terms of trends?
Yes. So around awareness, it's always been pretty good. So I suppose what I can say is there's the 95% that seem to be confident or fairly confident in reporting, identifying abuse, reporting abuse. And then there's always those 1 or 2 people that are not, or don't believe that it's as good as it could be. But I suppose it's about recognizing everyone's voice in that and thinking, what else can we do? So again, feedback's great, but I always like the feedback that can give you an opportunity or some kind of solution as to working towards improving something. So it's usually 95 to 98% really everything is tickety-boo, and then there's that kind of 5 to 3% that might say, actually no, I don't know. And then we don't look at individuals because it's not about that, but we'd also think, how are we inducting and training new staff? Did this person start within the last 6 months? And then trying to follow it back to how can we do more to make sure that everyone is aware and has the knowledge that we expect from them, because nobody should be lacking in awareness or knowledge. Like that's our job, to make sure that everybody has that standard. So if someone ticked that they didn't have the knowledge or awareness, I'd be looking at how long have they been in the organization. If they've been here a week, I'd say fair enough. But if they'd been here longer than 3 months, I'd be thinking, okay, we need to do something about that. And that might be that we review our induction checklists and see, are we missing people? Like what are we not sharing with people that they don't feel like they have that information? So that's an example of how we would use our annual survey.
Thank you, Marie. A couple of practical questions. One is, Neil has asked us, can you tell us what sort of mobile-friendly tool you're using to store incident reports, make sure people have done their training, storing the working with children checks and all that sort of stuff? So I guess, do you have a HR system that's mobile-friendly that you find is really useful?
We don't have anything that's really friendly, I suppose, is to point that out. And again, this is an opportunity for us as an organisation. So we have a HR system that works really well. And again, HR are a really key part of the whole safeguarding process for children. They have a system called Greentree, and they store all of the compliance requirements for staff. So if my Working with Children's card was due to expire in a month, Working with Children would inform the HR department. They'd also inform me, and then HR would contact me to say it's been flagged in our system that your Working with Children check card is expiring on this date, please forward us. So it does have that notification. And I suppose just to say that ACF, when they came here in July, they checked our notification system to make sure that we were regularly notifying staff that new checks were being done on them. So, you know, new police checks or new departmental checks. So Greentree works for HR, but how does it inform the L&D? The learning and development is quite separate, and that's my department. And we use our own new staff lists. So we haven't got a platform that speaks to the both at the moment, but that's an opportunity for us to improve moving forward, and definitely something I'm interested in. So if anybody out there has any wonderful ways of that happening, I would be really eager to hear your thoughts.
For those who are interested, Eracy uses a system called Employment Hero, which might be worth a look as well. We're not affiliated with them. I'm just putting that out there. We use them and it seems to work okay. All right, now I don't know how big an organisation Parkerville is, but this looks like an enormous amount of work, getting accredited, keeping the accreditation system working. For smaller organisations, and again, this goes beyond your direct experience, but I guess your opinion would be valuable. For smaller organisations, do you think there's a possibility that they could band together to sort of work on accreditation, share resourcing? Because it does, you know, I think that would potentially look like a very daunting task for a small organisation.
Yeah, absolutely, absolutely. You know, and that's the thing. It was a big project, and that's why they identified a person to lead that project. And again, that's resourcing. You know, they had to pay for that person to be, you know, for me to be here and to be working on this project. So yes, I do think someone could band together. I do feel that if you were, you know, didn't have the resources to go through the external and have them walk you through it, that you could definitely do it now with the resources available online. But it still does take people identifying a certain amount of resources to that project. You know, you can't. I would struggle. I wouldn't have been able to do what I did if I had that plus my full-time job here at Parkerville. So it definitely takes, and that's what I mean about the top-down approach. It has to be a commitment from the highest level around, we really prioritize this, so we're going to allocate this amount of hours in the week or this amount of money, or we're going to band together as, you know, as a group of smaller organizations. But it can be done, but it definitely takes prioritizing, and yeah, it's just, you know, people dedicated to it.
Thank you very much, Marie. I think there's a couple of questions that we didn't get to, but we'll pass those on to you. And of course, you've put your details up already, and I think you've very strongly encouraged people to ask you questions, and we'd reiterate that. People can see on their screens as well our details. If people have further questions for Marie and they can't find her details, send them through to us and we'd be happy to pass them on and help facilitate an answer. But with that, we'll say that's the end of today's webinar. Thanks again for your presentation and for taking the questions. Marie, an outstanding presentation. I'll just let all the audience know that the recording of this webinar will be available fairly soon for streaming online on the Eracy website. That's free for Eracy members. There's more events coming up. We've got some more webinars coming up between now and the end of the year, with David Crosby from the Community Council for Australia joining us, I think on the 26th of August, so keep an eye out for that. He'll be talking about the challenges that lay ahead for the community sector more broadly in terms of perhaps the surprise result of the last federal election, and also just the general structural changes that the community sector is facing. So plenty coming up on the Eracy website. Please keep an eye out for that. Thanks again, Marie, for a great presentation, one that I think everyone will find really useful and practical. And thanks for everyone who's attended.